Hi, Mr. Fett. My name is Jared. I'm going to be your nurse today. I understand you have a hard time speaking right now, so I wanted to establish a means of communication between us. When I ask you questions, could you give me a thumbs up for yes and a thumbs down for no? Thumbs up? Perfect. Thank you. So, just give me a second to wash my hands, and I'm going to check your wristband. All right. Is your full name Boba Fett and your date of birth 08/26/1969? Thank you very much. And I didn't happen to see an allergy bracelet, but do you happen to have any allergies of some sort? No? Perfect. Today I'm going to be performing some tracheostomy care on you. Have you had this procedure done before? No? Alright, let me just give you the quick rundown. So today I'll be suctioning out any secretions you might have in your tracheostomy. I'm going to be cleaning and assessing around the tracheostomy. I'll be replacing your inner cannula, or the tube that goes into your tracheostomy. I'll be changing out any old dressing and making sure it's clean and dry to prevent any infection. And I'll be changing that trach tire on your neck, which helps stabilize your breathing tube. Do you happen to have any questions or concerns? Perfect. So what I'm going to do now is I'm going to wash my hands for 20 seconds and put on a new pair of gloves. As I prepare to assess Mr. Fett. So, Mr. Fett, are you experiencing any pain today? No? What about shortness of breath? A little bit? Okay. Let me just check your vitals really quick. Your shortness of breath will be relieved after I suck out all the secretions that you might have. But let me check your vital signs. I see that everything is within normal limits except for your respiratory rate, which is 26, and your O2 sat level, which is 88. And I believe those will be a lot better once we suck out all those secretions. Is it okay if I could just listen to your lung sounds really quick? Thank you very much. Just give me a deep breath every time I change areas. You warm this up. Okay. So give me a deep breath. All right, deep breath. Okay, deep breath. And deep breath. Perfect. So I can definitely hear some gurgling sounds, which means there are some secretions present in your lungs. So we'll go ahead and suction that out. That should help with your breathing as well. So let me just go ahead and remove my gloves. Hand hygiene for 20 seconds. And I just want to do a quick emergency bedside equipment check. I see that the ambu bag is connected to 100% O2. Let me just go ahead and see if it works. Perfect. I see that the trach collar mask is hooked up to my patient, running at about 6 liters of O2 per provider orders. I see the suction catheter hooked up to the suction canister, running at about 100 millimeters of mercury. And I'm going to be changing that suction catheter because I'm not sure when it was last changed. I also see 2 extra trach tubes here, one which is a size 8, which is my patient's size, as well as a size 6, which is a size smaller. And I have 1 extra inner cannula. So now that I have completed my bedside check, I'm just going to go ahead and wash my hands for 20 seconds and put on a new pair of gloves as I prepare my table. So Mr. Fett, please bear with me because I have to wipe this surface down for 30 seconds. Alright, so let me grab this, a wet wipe, and I'll start wiping. Wiping this down. Alright, just going to dispose of this, as well as my gloves. So as this is drying for 2 minutes, I'm just going to do a couple more checks. I can see that you're already in a semi-phallus position, which is perfect. That's the position I need you to be in order to do my procedures. And to give you extra privacy, I'm just going to go ahead and close your curtain right here. So my table has been drying for 2 minutes. I'm just going to go ahead and wash my hands and grab all of my supplies. So I have here Mr. Fett's normal saline, as well as a trach tie, an inner cannula, an extra suction catheter, and the tracheostomy care kit. So what I wanted to do, hand hygiene for 20 seconds, was to change that suction catheter. So let me just go ahead and do that right now. I'm going to go ahead and put on a new pair of gloves. Take the suction catheter and remove it. Grab this suction catheter, open up the package, put that in, hook it up, put that right there. I don't know what was on that last catheter, but I just want to change my gloves just to make sure there's no cross-contamination or anything. I'm just going to wash my hands again for 20 seconds and put on a new pair of gloves. And prepare. Dispose of this. Open up the well. And open up my tracheostomy care kit. Like so. We're going to be discarding of the sterile gloves because I'm not going to be needing those for the procedure, as well as this trach tie. And I'm going to grab the drape, only touching that 1-inch border. And I'm going to be placing it on my patient, making sure that the shiny side is face down. Then I'm going to grab my inner cannula. I'm going to open it up and dump it into my kit. Throw that package away. I'm going to then grab my saline, pour it into the care kit, the little well, the care kit, as well as this well right here. Put that to the side. Now I'm just going to change my gloves. Wash my hands for 20 seconds and put on a new pair of clean gloves. So right now, Mr. Fett, I'm getting ready to suction out any secretions, but before I do that, I'm going to want to hyperoxygenate you to increase your O2 sat levels. Is that all right with you? Okay, perfect. So what I'm going to do is I'm going to hold the faceplate and remove the O2 mask. I'm going to grab my ambu bag, and I'll be giving you 2 to 3 breaths with 6 seconds in between. Are you ready? Okay, perfect. Let me go ahead and put that in. Alright, let me put that collar back on. So looking at your vital signs, I can see that your respiratory rate dropped to 20 and your O2 sat level has increased to 98%, which is perfect. So I believe we can start suctioning now. It might be a little bit uncomfortable. It's going to make you cough, but I'm going to work as quickly as possible. So let me go ahead and remove your O2 collar again. I'll grab my suction catheter. I see that it's running at about 100 millimeters of mercury. Let me just test to see if it works by putting it into the well and sucking out some saline. It works. So I'm going to go in for 3 seconds, and then I'm going to pull out for 6 to 7 seconds. And in between those two, I'm going to feel some resistance and you might cough, which is all right. Are you ready? Okay. 3, 2, 1. Okay, how was that, Mr. Fett? Perfect. So let me just go ahead and suck out some saline to clear this of any secretions. I'll put that O2 collar back on. So, did you have any pain? No pain? And I could see your vitals again, your respiratory rate decreased to 18, and your O2 side is still at 98%. Would you like some more suctioning? No, perfect. I could also see that you're breathing a lot better. So my patient didn't need any more suctioning, but if they did, I would wait 30 seconds before suctioning them again and hyperoxygenating them if necessary. So let me just go ahead and remove my gloves. Wash my hands for 20 seconds and put on a new pair of clean gloves. So right now, Mr. Fett, what I'm going to do is prepare to change your inner cannula and change that old dressing. Alright, so are you ready? I'm going to be changing your inner cannula first. Alright, you ready? Okay, so let me hold the faceplate, remove the O2. It's going to make you cough, but I'll work as quickly as possible. Ready? 3, 2, 1. Move that. Grab the new one by the wings. Just put that in. How was that, Mr. Fett? All right. Okay, so now I'm just going to remove your gauze. Dispose of that. And I'm just going to quickly assess this site. So I don't see any redness or swelling or any skin breakdown or any signs of infection, and the trach is intact. But do you happen to have any pain directly on the site? No? Perfect. So what I'm going to do now is I'm going to prepare to clean around that side. So let me grab a Q-tip. I'm going to soak it in some saline. And with one swipe, I'm going to do the top. Grab the other Q-tip. Soak it in some saline. And I'm going to swipe the bottom behind the faceplate. I'm going to grab a gauze. Soak that in some saline. And I'm just going to wipe that top portion with one swipe. Dispose of that. I'm going to soak this with some more saline. And I'm going to wipe the bottom like so. I grab another gauze, soak that in some saline. And I'm just gonna scrub that faceplate around your trach, the inner cannula. Right here. Making sure it's gonna be squeaky clean. Okay. Dispose of that, and now I'm just gonna dry it with some dry gauze. Pat that dry. Pat that dry. Okay. Now I'm going to grab the split gauze and I'm just going to put this behind your faceplate, Mr. Fett. Starting with the left side, put that in. Put it on. Okay. Now let me just put your O2 back on. So, was that painful at all, Mr. Fett? No, perfect. So, now what I want to do is I'm just going to go ahead and clean my area. Dispose of these, and I'm gonna quickly grab another nurse to help me change your trach tie. So let me go ahead and remove my gloves, wash my hands for 30 seconds, and before I leave, I'm going to make sure your bed is in the lowest position, side rails are up, and your call light is in reach. So give me one moment, I'm gonna go ahead and get another nurse.